Hello and welcome to the Nursing Career Transformation Roundtable. My name is Kate Loving-Shank of the katelovingshank.com, and I am the host of this roundtable. My hope is to give nurses a voice and also to become a catalyst for nurses to feel good about themselves. My guest today is Tiffany Martin, BSN, RN, who has a passion for holistic nursing. So join me in welcoming Tiffany. Hello, Tiffany. How are you today?
I am awesome. Thank you for having me.
Oh, this is great. Well, we were talking about holistic nursing, but a lot of us don't start out doing the kinds of things we would prefer to do in nursing, and so you're probably mixing and matching it up right now. Right before the show, we were talking about what you do right now as a nurse. So what do you do?
Right now, as a nurse, my full-time job is in a large teaching hospital. I work in a recovery room and take care of pretty much all surgical patients except for cardiothoracic and like lung transplants. But everything else, from outpatients to endoscopies to appendectomies to orthos, we do it all.
Well, it seems to me that you have the opportunity in that job to utilize your healing capabilities. And I'm sure you do. And how right now, how are you using your healing, your healing talents to help your surgical patients?
The first thing I do is always a self-check. I feel like as a nurse, we are the beginning of their healing stage because we are, or we should be, a healing presence. So my first mission, my first job, my first duty as a nurse is to always make sure I'm fully present, I'm aware, I'm conscious, and I'm in the moment to care for that person.
Mm-hmm.
Only then am I able to kind of mix in my holistic modalities or just, my holistic nursing. And it doesn't take much to do that because, just starting being that healing presence, that is holistic nursing, having in mind that you're going to do whatever you need to do to get that patient in the, best position for healing.
Awesome, awesome. Did you find that your first interest was holistic, mind, body, and spirit, or was it nursing first in your path?
In my path, thinking about it now, I think that initially it was holistic to start with, but I didn't have the terminology to define it, or I didn't know what it was until I discovered, the Holistic Nurses Association. So it started with just the desire to be a nurse. And as I learned and grew as a nurse and discovered holistic nursing, I'm like, wait a minute, this is what I wanted to do all along. This is what it's all about. This is what I've been doing.
So did you become certified as a holistic nurse with Barbara? I forget her last name at the moment.
Gosh, and I'm drawing a blank too. Dosey?
Dosey. Yes, Dosey, I guess.
Dosey. Yeah. No, I'm not certified as of yet.
Oh, you're working on it.
Working on it.
Oh, good for you. Congratulations. That's great.
Thank you.
And I understand, too, that you took a course in August with the yoga nurse, and now you are a yoga nurse. So tell us about that.
Well, Annette Torsini, she is the yoga nurse, and she is wonderful, and she offers a wonderful, wonderful, life-changing course for nurses. She does offer certification as a yoga nurse. I am not a certified yoga nurse, as there's additional steps to becoming a yoga nurse. What I did is I took her online Yoga Nurse Essentials course, which she basically teaches you a lot of self-care first. The foundation of the yoga nursing is self-care for the nurse. But she also teaches us postures and breathing and relaxation methods that we can teach to patients, families, businesses, just about anyone. And then she also has a wonderful, wonderful segment on marketing of, teaching nurses how to go out and market yourself so that you can, become a little nurse entrepreneur. So I took that online course in August, and it's only October, but it has really just opened up so many doors for me, and it's been great. I'm so glad I took it.
Oh, that's great. And of course, what we're doing now, let me just get myself here. And what we're doing now is basically a part of your marketing strategy, I would think.
Yeah.
Yeah, Google Hangouts are one of the most it has immediate Google juice, as they say. It's Google juice.
I like that.
Yeah, pretty soon we'll be on the first page of Google with these roundtables, and your name will pop up in Google, whereas before it might not. It might have been more elusive, you know. What we need is to have, pages. We need to become visible as in what it is that we are trying to promote into helping the world and helping people. And the best way to do that is to get front page presence on Google. So this is what will help you do and help us all do. Yeah, so marketing and nursing entrepreneurship and all that kind of great stuff. I know that when people think about yoga, they think that it has to be very complicated postures, but I know that it's not. So tell us a little bit more about the kinds of yoga that you do with your patients.
I'm so glad you brought that up, because so many of my family members and friends and even coworkers, they'll say, "Oh, Tiffany, I can't do what you do. You do all those fancy poses and you're flexible and yada, yada, yada." And it's my mission to show everyone that that's not what yoga is about. It's not what it's about at all. The poses itself is just a very small percentage of yoga. What I incorporate with my patients is, first, the easiest and the most beneficial thing I think is the breathing. Just becoming aware of your breath and practicing some breathing and meditation can transform your life, can transform your health. That's a big component that I want to share, not so much the poses.
That's so true, yeah.
When you think about it, where I work, post-anesthesia care unit, my patients really can't get up and move and do postures anyway. So the Yoga Nurse Essentials and my yoga training so far, implementing that breath work has just been fantastic. That's enough for me right now to deliver to my patients. But it doesn't stop there. Of course, you can kind of branch out and teach basic little stretches and things like that. More of a gentle postures I would recommend to patients.
Right. I love what you said about the breath and how so many times people forget to, not that you can really forget to breathe because you have to breathe to live, but I think we forget to be conscious of our breathing.
Absolutely.
What kinds of things do you recommend for our audience to become more conscious of their breath so that they feel more alive and more present in the here and now?
I would recommend what I learned myself, and it's just, again, like you said, consciousness. It's, if you discover you're feeling a certain emotion or a certain twinge in your body or something like that, you can always stop and just say, what's going on right now? You can always just stop. And it doesn't take long. You can take a few deep breaths, and for the most part, it always relaxes you. Then you can explore maybe what's underneath that pain or what's underneath that emotion, because your mind is now clear.
Mm-hmm. 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 Yeah, I know in the training that I have taken, we always talked about the loving field, creating a loving field, which is very much part of what you're talking about and what we're talking about here. Mm-hmm. And it has to do with coordinating breath from the ground into your body to your heart, and from the universe through the top of your head to your heart, and you're kind of mixing from the heart to the ground and balancing the energies, and then sending love out. Mm-hmm. But as you're mixing and matching the energies from within, you're actually loving yourself in the process. So the healing field is something that I practice with patients just as a way of centering my care for them. So it would be, it doesn't seem like we're doing anything, but what we're doing is creating a state of being with our patients.
Right. And you mentioned we're not doing anything, but at the same time, it's something that we're kind of already doing, just being there. It's just that we're now aware of it and we can put a name to it.
And the patients, they recognize the energy. They may not
consciously
recognize it. But they might say, well, thank you for everything that you did, when in reality, you may not have been doing much of anything except creating a loving field, or creating a conscious breath, or creating an atmosphere of healing. And I mean, I know as a nurse we have to do a lot more assessments, and we're doing a lot of stuff with the machines and blah, blah, blah. But if we first and foremost create that atmosphere of love, then the patients feel that. Has that been your experience?
Yes, it's my experience every single day of my life as a nurse. Creating that love and field, it's so beneficial for them.
Yes.
It's amazing.
And for you?
Oh my gosh, yeah. My
yeah.
day is so much better when I'm able to create that love and field and set the stage, and everything just flows. You know, my coworkers often say, Tiffany, your patients are so calm and they're so relaxed that you never get crazy patients. And I only say crazy because sometimes, you know, people wake up from anesthesia a little bit off. And I really feel that it's my vibration radiating out to them, affecting their energy fields.
Right.
And I can't remember the quote she says, but I think it's something like creating calm in your heart creates calm in your patient. Mm-hmm. And I can testify to that time and time again. Calm nurse, calm patient.
Yeah, we'll send some calm to your dog over there.
Oh, my dog is crazy.
It's okay. We have one of those too.
Oh yeah, she's a big old protective German Shepherd. So whatever she sees, she just wants to kind of get rid of it. Probably something like a squirrel or something.
Oh, squirrels!
That's crazy.
I think that must be a common thing with dogs. They have a thing about squirrels, don't they? Oh, let me see.
There she is.
Hi, sweetheart. Hi, sweetie. Aww.
No. It's okay. It's okay.
Oh, she's going, who is talking? Animals can really, I wish we could take animals into hospitals, don't you?
Oh my gosh, yes.
I mean, I know you can into nursing homes, but boy, do they have the healing ability. Amazing.
They do.
They lower blood pressure, or they just watching their antics just create, and if you breathe with them, oh, I love to do that. Breathing with my dog.
Oh, she is just really acting up.
We understand. We dog lovers always understand.
I'm so sorry.
Oh, I totally love it. I totally love it. Well, I have a dog named Pearl, and on her birthday, she was a wild dog in Tennessee, and last week was her 3rd birthday, and she actually caught and killed a squirrel and ate the liver. And
dear.
She had the greatest day of her life that day. She must have needed the enzymes.
Yeah.
So, getting back to our topic,
yes,
which is everything. Healing is everywhere. You know, it's the more that nurses can access the healing that is everywhere and within themselves and everywhere else outside, I think they can become better nurses, but I don't think a lot of nurses understand that. So how can we impart that great piece of wisdom to them?
You bring up another great point. Yeah, I too know. I witnessed it every day as a nurse that some nurses, we're just not aware of that healing potential and the healing instrument that we are. And I think a good way to spread that message is through not only Annette Tersini's Yoga Nurse Essentials course, but just encouraging nurses to seek other opportunities, just to know that there's more out there than hospital nursing or nursing home. Because I feel like a lot of nurses get discouraged with their career because they feel like they're trapped. Mm-hmm. We want to encourage nurses to expand their consciousness. And we can do that with the Holistic Nurses Association, just kind of coming together, these wonderful hangouts. There's so many ways to reach out to each other.
Right, and to create a community of nurses who are interested in that, which is what we're doing now. you and I met on a Facebook page called Nurse Up, which
Yeah.
I think has done, Andrew Lopez has done a beautiful job of bringing so many of us together, which I think we might have actually, I know I personally felt kind of alienated from nurses until I started to hang out there a little bit.
Hmm.
He's really done a beautiful job.
He has. His site is wonderful, and his Facebook group he's created. I mean, it's amazing.
Yeah, a
I
lot of people
joined
are
maybe
interested.
a few months ago and look at the opportunity that I have now from him because I met you through him.
Right, right. I love him. I think I want to get him on here too. I just think he's just quite a way of I guess he's a real networker, you might say.
Oh yeah,
The greatest definition of a networker would, or the best example of a networker would be him.
I agree.
Seems like he does it 24 hours a day. He must love it.
That way, yeah.
And he's open. He's open to holistic nursing. He's open to healing. He's open, and this whole Ebola scare and reality actually
Hmm.
is something he's really spearheading on the site. And I think that the whole idea that nurses are being thrown under thrown under the bus for they're actually getting the blame especially in the Dallas situation. Um, that and I think I'm talking to more nurses who actually see that those nurses are being blamed for something that wasn't their fault.
Hmm.
When especially when the CDC says that protocol was broken, there wasn't a protocol. There wasn't a protocol. Yeah. So nurses need to know. I think that if we can create a a platform for nurses to feel uh, a part of something as opposed to being singled out, and the way that doctors treat nurses and the way that administrators teach nurses, those sorts of things have got to come to an end. And I think that at least what we're doing here and what Andrew has created helps nurses to feel more a part instead of separate. Yeah, I think so. Do you think that, well, I know it's probably not a good thing to talk about, but do you think your administration supports nurses pretty well?
At my hospital, I do. We are a magnet hospital, and I believe that administration within our institution, I do believe they support us within their means. I mean, I don't understand administration at all, so I don't know how much they have to take on and things like that. But my everyday life as a nurse, I feel at my institution, I am supported, and I'm very thankful for that because I know it's not like that everywhere.
I think one of the most important things that can be implemented for nurses is what we could call a wellness program, where because we do confront a lot of tough situations, first responder situations, and especially in the emergency room, or I actually am more of a first responder where I work now than I ever was in the hospital, which is we're working way out in rural Pennsylvania with natural childbirth and a natural childbirth clinic. And when things go wrong, we are the first responders. So many times in the hospital, you can just call up a whole team of people who will come and help you. But you're like out there, and I think that what helps people get through that would be a very good wellness program, and calling in the clergy to help people get through some of the spiritual issues they might confront with some of the kind of gruesome situation, well, especially confronting death and knowing that we haven't saved a life, helping people realize that we can't always save a life. We can't always be the ones to be the heroes, as it were.
Right. And that's a very hard hard piece to speak about as a nurse, because as a nurse, and I think as a healthcare professional in general, we do kind of always want to have good outcomes, and patients want good outcomes, and families want good outcomes. But the reality is, sometimes the good outcome is death,
Yes.
and death is just a hard concept for a lot of people, nurses, to accept and to come to terms with. Yeah, I can understand that.
You think that there's that's because of a fear of death in the nursing profession? Well, everybody is afraid of death, basically, in the whole population of people.
Yeah, yeah. I think it's just people in general, not necessarily just nurses, because as a nurse, we're people first. So I don't think it's a nurse thing that we are afraid of death. I
Right.
think it's the person in us.
Right. That's a good way to say it. But in our profession, we are confronted with so much death and life and joy and sorrow that I think that we might come to terms with death faster than so many other people in the world. And so one of my main passions has always been bringing death out of the closet, but it's something that confronting that face on never really works so well. People kind of shy away from it. But I think nurses are one of the more strategic people to bring death out of the closet and to have people feel more comfortable with it. You know, there's a whole movement where people actually get together in so-called death cafes, and they discuss death as if it were a normal part of life, and they don't discuss death in a way that makes people run out the door, but it's just in a way that makes people feel that it's a part of life. So I think that we need that in our society. It's almost like the last thing to come out and be exposed for what it is, when it's just as natural as birth.
Absolutely. Absolutely. Because death is, whether we want to admit to it or not, death is a part of life.
Yes.
You know, there's a birth, everyone has a birth, and everyone's going to have a death. And that's awesome that there's the death cafes that are helping people to realize that it is a part of life. It's a very normal part of life.
Yes. And the more we can bring people to that consciousness, I think there's certain theories that say that the fear of death is at the heart of all fear. And if we can bring ourselves into a state of peace about that one fear, which is the fear of death, then we would be more whole, more integrated human beings.
Mm-hmm.
And the work of that could be done. I think nurses are pivotal for bringing that out of the closet. So that's just one of my things that I've been thinking about for the last several years.
Well, that's awesome, Kate. That's an awesome mission to kind of be working towards, or working with, rather.
Yeah, I think it's probably better to work with nurses as opposed to just kind of running out in the streets and get out. I did do a Google Hangout series on that topic, and it was really awesome. But
I'll have to check that out.
I'll show it to you sometime.
Okay.
Yeah, so that's one of the things that holistic nurses could easily be pivotal with that one little thing, just in the way that when you become at one with all that is, then you're basically getting rid of the fear of death.
Absolutely. Absolutely.
Because you see that there's an ongoing quality, an eternal quality to life that goes so far beyond this life that we are living.
This physical body.
Yeah.
There's more.
That's right.
There's more right now, not just after death. There's more to this physical body right now.
Absolutely. Yes. So, what do you do to be healthy? How do you take care of yourself?
How do I take care of myself? That's a great question, and I've learned over the years to just incorporate taking care of myself in every single thing that I do. So I'll give a little quick rundown of my day, because
Good.
As a mom and as a nurse and as a wife and all these titles and hats I hold, I still don't have that time where I can just set aside maybe an hour a day to really have me time. So what I do is, in the morning, I meditate just for maybe 2 minutes or 5 minutes, just kind of waking up, center myself, set an intention for the day. Mm-hmm. I get myself ready. I have my tea in peace and quiet. Try and shut the phone off while I'm doing that, or just leave it out of the room. If time allows, There's, maybe 10 or 15 minutes I can practice a little yoga. And then I'm out the door, whether it's going to work or going to drop my kids off.
Mm-hmm. Mm-hmm.
Another thing I like to do before work every single day is a good 5-minute timeout in the car, because that lets me leave, whatever's on my mind right now, right there, to not bring it into work, to not carry it all day, to just let it go right then and there.
Mm-hmm. Mm-hmm.
And then, of course, throughout the day, whatever comes up, if I have, stress or anxiety, or I'm feeling anxious or I'm upset, I know how to take time out. And that's what I do, and that's pretty much what I do. Of course, with eating healthy and kind of connecting with myself when I can. That's pretty much how I maintain my healthy life. Taking it's part of everything that I do.
Right. Oh, I like that. It becomes not just a separate part where you meditate for 2 hours, but you meditate meditate all day long, maybe.
Absolutely. Absolutely.
Yeah. That's great.
Yeah, my dog is here trying to get my food from earlier.
How old is your pup?
She just turned 2.
Oh, she's still a puppy.
Yeah, she's still a baby.
How old are your children?
My daughter is 7, and my son will be 5 next month.
Oh, I bet they're beautiful.
Oh, I think they are. They are.
So they probably become your why. Would you say that?
My children are my lives.
Your why you do what you do.
They are a big part of it, absolutely. Absolutely. Mm-hmm. But I believe that, as a nurse and as a mother, you can't let an external force be your why for anything. You have to be your own why.
Oh, I love that.
Start out as doing it for, I want to be a better mom, or I want to be a better this. But you're kind of doing it for someone else. You need to do it for yourself. So, everything that I did started with them initially, but somewhere along the path I realized, Tiffany, you got to take care of yourself. You want to do this for you, because one day those kids are going to be grown, and your life's not going to be centered around them anymore. I mean, it probably still will be, but they won't center their lives around you.
That's right. Well, not only that, but they have you as an example of somebody who's taking care of themselves, and that's the model that they need to incorporate in their own lives, and that is perfect.
Thank you. Yeah.
Do they like that you're a nurse, and do they recognize? Well, your 7-year-old, does she know what you're doing, and how does she understand?
She does. Yeah, she's understood from a very young age, because I graduated nursing school when she was just a baby, but I could remember going to her preschool class when she was 3 for career day, and she got up to introduce me to the class, and she says, my mom's a nurse, and my husband's a respiratory therapist, so they don't quite get what he does, but they'll always say, our mom and dad save lives. They work in a hospital, and they take care of sick people, and they really help people feel better. And even as a little 3-year-old, she understood that.
Yes.
Understand, and they know what a stethoscope is, and they know what nurses do, and they know how nurses affect the world. They both get it, and they are both very proud, I must say.
Oh, it's lovely.
They're proud to have mommy be a nurse and work in a hospital. They think it's the coolest thing ever.
And it is.
It really is.
Totally cool. Yeah.
It really is, and I love that they're so proud. It just makes me so happy. They're so proud.
That is totally adorable. Absolutely. And children. It's funny though. That kind of speaks to the fact that people get what nurses do. They are the most, in the eyes of the population, people really value nurses, and they want the best for them, and they recognize what a good nurse is, and usually what a good nurse is somebody who cares for them. I like that ring. So, it has to do, people know what a good nurse is, which is somebody who actually listens to them and cares for them. Mm-hmm. And it's not how great you computer chart, or it's not how great you take care of all the, obviously we do want to take care of everything technologically for them, and also make sure that their IV solutions are compatible and all this. But they really want us to love them and to take care of them and to listen to them.
Absolutely. And by doing that, you're able to work on that technology, or you're able to make sure your drips are running properly, because the first thing you're concerned about is making sure that person is taken care of in the best fashion.
That's right.
It's easier to, sit down and, oh, did I make sure these strips are compatible, or did I get that documentation down, or did I make sure my hands were clean and washed before I went to go change their dressing?
That's right.
Your basis is you want the best for them.
Yeah. So all those things are totally automatic for us, but what often is not automatic is people not being able. Nurses really often can't listen. They have to give advice. They're not creating the loving field. They're not doing the things that need to be done on top of making sure a patient is safe. And that's the kind of thing I hope these programs help nurses to incorporate into their practice.
Mm-hmm.
Yeah. So do you have any parting words of wisdom for the nurses out there who are now not only listening now, but who will be listening in the future?
I do. And this came on my heart as I was driving back from dropping my kids off. I just kind of thought about how often I hear that nurses are unhappy or sometimes embarrassed to be a nurse or frustrated with being a nurse. I heard someone say, oh, I think my daughter wants to be a nurse. I'm scared for her. And I just want to let nurses know that, yes, we have a very stressful job and we may not feel supported all the time, but we as nurses need to know our value and our true potential. There's so much that we can do. There's so many different positions we can acquire. There's so many ways you can be a nurse. Mm-hmm. And I feel like if nurses, if we do our homework and our research and, gather around people who are doing different things in nursing, you can realize your potential and you can be a happy nurse. But you have to open your mind and you have to step out of the box, because I feel that no nurse should be unhappy as a nurse. There's something else you can do. There's always something else. You just have to trust yourself to seek that opportunity.
Right. And happiness is an inside job.
Mm-hmm.
And once we realize, and as you said before, that our happiness can't really depend on anything outside of ourselves. And once we realize that it's totally inward, then I think we have a chance to be really awesome nurses. Totally.
I agree. I agree.
Okay, my dear, so I think we can wrap this up. I appreciate so much your being here today, and we can bring you back anytime you want and talk more. It was great. You're a great guest. It was wonderful talking with you.
Oh, it was so wonderful speaking with you. This was awesome.
Good.
Love to do it again.
Yeah, we can just pass it all over the place. So.
Yes.
Love to you.
Love to you as well. Take care.
Yes.